नेक्स्ट फिर यही करना है, नेक्स्ट ये करना है, हो गया। Hello everyone. Today we are going to talk about optic neuritis. Now we would like to know what is optic neuritis. Before that, where is optic nerve and what is the function? Here you will see that the optic nerve is a bundle of nerve fibers which transmits the visual information from nerve. And what is the function of the optic nerve? The function of the optic nerve is visual acuity. That means what is a vision. And second is a color vision and the form of the object. That is about the function of the optic nerve. When you talk about neuritis, there are two types of neuritis where you will see that in front optic disc which is there just when it starts. Swelling of the optic disc, that is known as papillitis. And sometimes it happens the optic disc is not swollen, the inflammation is behind that, and that is known as a retrobulbar neuritis. And third is a retina also is involved, that is known as a neuritis. Now we would like to know exactly most common causes are usually surrounding infections like thyrotoxicosis, also if there is a swelling of the muscles. This is regarding the infections. And we have to ask about history of vaccination, history of or any other viral infection. And very important, especially in retrobulbar neuritis, you have to ask history of any drugs taken, especially antituberculous drugs like ethambutol can lead to optic neuritis. And other causes are demyelinating diseases like multiple sclerosis or neuromyelitic optica. So these are the causes of your optic neuritis. Now we would like to know what are the symptoms, how the patient comes to you. Here, either suddenly the vision is reduced or some vitreous floaters are there. That means some spots are there which are coming in your visual pathway. And there's a pain while movement of the eyeball. This is also one of the symptoms. And very intelligent patients can tell you that the color vision perception is not proper, the black is reduced. And sensitivity reduced. So these are the symptoms of neuritis. What times? What here you will see the pupillary reaction when you throw the torchlight. You will see the pupil reacts. It becomes small when you throw the light on the pupil. Here the pupil is semi-dilated and reaction is sluggish. Slowly it will constrict and again it gets dilated. So this is about the pupillary reaction. And when you do ophthalmoscopy fundus examination, there is a disc swelling. Not necessarily all the time there is a disc swelling. There may not be disc swelling also, especially in retrobulbar neuritis. Now, what are the investigations? As per the cause, you will have idea what are the investigations. You have to rule out tuberculosis, syphilis, sarcoidosis, thyrotoxicosis. And any optic neuritis, you have to do MRI brain and MRI demyelinating diseases like multiple sclerosis, David's disease, and X-ray chest, especially for sarcoidosis or tuberculosis, and PNS, that is about the paranasal sinuses, if there is a sinus infection. Now you will know that, especially in allopathy, all the causes, whatever the cause, usually we start with the steroid. IV steroids are given for 3 days and then taper off. In certain diseases, some other, suppose the infection is there, tuberculosis, you have to start antituberculosis. Treatment also, syphilis, according to the cause, you have to treat the cause. So you know that side effects of steroids. Sometimes it happens that again the optic neuritis is reduced, your vision also comes back, but recurrent chances are very high, especially in multiple sclerosis and David's disease. So all investigations and proper ophthalmological examination are important. There are various pathis you can go for it to decide what you do. Thank you.
All right. So, hello. So, I think Dr. Pushpa has already discussed in detail about optic neuritis and the different kind of causes, symptomatology of optic neuritis, and if someone can go back to the kind of table of causes of optic neuritis, it will help me to analyze. If someone can put that back. Second slide. Right. So, hello. Yes, the second has already discussed in detail about. Perfect. So I think once one understands. Yeah, I think the voice is echoing, so we'll have to find a way not to avoid this kind of echo on the video. So it'll help me to analyze if someone can put that back. So it's like hello. Yes, the second has already discussed. Perfect. Okay. So we are discussing about the possible causes for optic neuritis, and especially this is something very important because you want to also understand about the homeopathic approach in these cases. Why is this a very interesting table for us to understand the homeopathic approach? Because your basis of prescription could also change depending on the causes, depending on the type of disease underlying the optic neuritis that you're treating. For example, if you're treating a case of a multiple sclerosis with optic neuritis, then the remedy that you choose will have to be a remedy which you're prescribing at the basis of the mind and body level. You'll have to prescribe what they call as a constitutional remedy. And as you know, cases of multiple sclerosis, even cases of all these kind of diseases like that, just systemic cases, have a lot of kind of origin in the psychosomatism. You have to understand the state of mind, the generals, the fears, the dreams, the childhood, the past history, the family history, so much in detail. And once you go so much in detail, then you form a portrait of disease in homeopathy, where you find a remedy for the person. So when you choose prescribing homeopathic prescribing at optic neuritis, when the cause is multiple sclerosis, a very, very systemic kind of disorder, then the remedy will have to be a much, much deeper remedy that covers the miasm, that covers the genius, that covers the entire portrait of disease. On the other hand, when you're treating a case of optic neuritis, where the causes will be other than the demyelinating kind of cause, which maybe after vaccination. Again, here you could look at homeopathic remedies, and you know that by the idea of homeopathic remedy, thuja is one of the very important remedies for post-vaccination optic neuritis. Also, infections. Could be many infections that can cause these kind of problems. Sarcoidosis and autoimmune cases, again, there is no homeopathic remedy for just sarcoidosis or autoimmune disease. There is no specific. You will have to understand again a remedy which acts at the mind and body level. So you'll have to prescribe a remedy based on much deeper patterns of a patient when you see an autoimmune disease or sarcoidosis at a deeper level. But there are some very important clinical remedies I would like to talk to you about. Patients who are on too much of tobacco chewing or smokers and gradually develop optic neuritis and optic maybe atrophy also. The remedy, which is very important, is the homeopathic remedy, tabacum. It's a very important remedy for optic atrophy and optic neuritis. The other very interesting remedy, and there are two remedies which are very interesting, which are put up. One is thyroidinum, and another very interesting remedy is carbonium salt. These two are very important remedies for optic neuritis and optic atrophy. Typically, they cause a kind of a central scotoma, which is a very kind of a darkness as a central area in the peripheral vision. Many such kind of optic nerve related disease. One of the most important remedies is phosphorus, which is also interesting because in phosphorus poisoning and toxicity of phosphorus, the optic nerve, and there is a nerve degeneration, nerve destruction. This makes phosphorus a very important remedy for such kind of cases. But you always prescribe phosphorus, which is a full-fledged polycrest remedy based on the physical generals, on the mentals, on the physical particulars. Proper polycrest remedy, well proved by homeopathy. When due to an injury, there is optic neuritis or optic atrophy, the very important remedy Fata gives is plumbum metallicum langeum. So that's another very important remedy that you want to keep in your mind. There are many remedies for optic neuritis. The typical belladonna, the typical bryonia, the typical gelsemium, naxomica, pulsatilla, arsenic, mercur. Again, based on prescription, based on indications. If a patient tells you that there's a lot of throbbing pain with this optic nerve in the eye, which is better by hard pressure, you will start thinking about bryonia. When you see this kind of throbbing pain, which is aggravated by slightest touch, it could be belladonna with this photophobia. So you have to understand the peculiar individual symptoms while prescribing. However, most cases which we are treating are cases with the underlying kind of autoimmune disease, underlying kind of myelinating disorder like multiple sclerosis, like autoimmune disease, like so many other cases, require a very deep indicated homeopathic remedy, which you kind of prescribe after taking the case in depth, after finding the remedy for the person, as they say. So this is a little bit of approach about the homeopathic approach in these cases. And I hope that this helps some of my colleagues and my friends in homeopathy. Thank you. The other very important thing that you want to also talk about before I finish is the holistic approach, that is importance of nutrition, plan, diet. Certain food items are very healthy for it. And that's why here we have started an integrative homeopathic clinic, where along with homeopathy, we have a nutrition, we have certain yoga exercise. When it works together, the results are remarkable. And that's why we want to invite you for this integrated homeopathic clinic. With any kind of health related issue, you can connect to us. You have all the details below, gaurang@gmail.com, the phone number. Our clinic is here in the heart of the city in Mumbai. So take benefits of it and write to us. Thank you.